The History of Physicians, a visual timeline by Barton Associates. Before we get into the more recent history, it's important to note where it all started. People have been practicing medicine since before the invention of writing. The earliest mentions of medicine as we know it are cave paintings dated back to 27,000 years ago. Prehistoric medicine encompasses a wide range of time periods and regions, since different cultures invented writing at different times. Early medicinal practices included healing ailments with plants, clay, and even surgery. Anthropologists have found evidence of early surgical practices across many different regions. It goes without saying, the physician profession has changed a lot since then. We'll get started with one of the earliest and most widely known medical texts, which was written by ancient Greek physician Hippocrates sometime between the years 500 and 300 BC. The Hippocratic Oath established a code of ethics for physicians to uphold the art of medicine to the best of their abilities and only act in their patient's best interest. The original version of the Hippocratic Oath required new physicians to swear to the Greek gods involved in healing that they would uphold the ethical standards of the oath. Obviously, it's since been modernized, but many new physicians still recite some form of it at their graduations with the same message. First, do no harm. Between the years 1100 and 1300 AD, early modern medical schools were founded in Paris, Bologna, Oxford, Salerno, and Montpellier. These early institutions' teachings combined the various schools of medical thought, such as anatomy, medical astrology, rudimentary surgery, and the use of medicinal herbs. Much of the curriculum was based in the translated work of Hippocrates and other historical medical scholars. In the year 1400, the word physician was finally defined in the third edition of the shorter Oxford English Dictionary. Fun fact, according to this edition, physicians and surgeons were actually members of completely separate professions, and as such were considered rivals. Fast forward to 1766, and the first medical organization was founded in New Jersey. The New Jersey Medical Society was developed to form a program embracing all of the matters of the highest concern to the profession. These included regulation of practice, education standards for apprentices, fee schedules, and a code of ethics. Then, in 1847, the American Medical Association, AMA for short, was established. The establishment of the AMA led to a number of innovations in the medical field, including the creation of educational standards that physicians still adhere to today. The year 1849 was a big year for women in medicine, when Elizabeth Blackwell was the first woman awarded a medical degree. She began applying to medical schools in 1847, even though she knew no woman before her had ever been allowed to study medicine in the U.S. She applied to 19 schools before she was admitted to Geneva Medical College in New York after the faculty put her admission to a student vote. Fun fact, Elizabeth graduated at the top of her class and went on to train nurses during the Civil War. At this point, it became clear that there was a lot to celebrate about physicians and their history, so in 1933, National Doctors' Day was born. It started when Eudora Brown Almond, wife of Charles B. Almond, chose to honor physicians on the anniversary of the first time general anesthesia was used in surgery. Of course, this wasn't the last time that physicians would make history, so our timeline goes on to 1937, when the first hospital blood bank was established by Dr. Bernard Fantis at Cook County Hospital in Chicago. Fantis was the first to use a 2% sodium citrate solution to increase the shelf life of refrigerated blood to nearly 10 days. About 30 years later, history was made again on December 3, 1967, when Dr. Christian Barnard successfully completed the first ever heart transplant to a patient suffering from heart failure. The patient lived an additional 19 days before unfortunately succumbing to pneumonia caused by anti-rejection drugs' effect on his immune system. However, Barnard's second patient was able to leave the hospital and lived an additional 19 months. The year 1982 saw another huge innovation in heart surgery when cardiothoracic surgeon William DeVry completed the first surgery implanting an artificial heart in a human. After a 7-hour surgery, the patient was able to live another 112 days. DeVry went on to implant 4 more artificial hearts with increasing levels of success. The turn of the 21st century also came with its own huge innovations in medical technology. In September of 2001, French surgeon Jacques Moresco completed the first remote laparoscopy. The operating physician was located in New York, while the patient receiving the surgery was nearly 3,700 miles away in Strasbourg, France. The successful procedure was the first of its kind and has potential applications in battlefield medicine and disaster relief. The next medical advancement was all the press could talk about in 2005. two French physicians, Jean-Michel Dubernard and Dr. Bernard de Vachel, completed the first successful facial transplant surgery. The physicians were able to forego traditional reconstructive surgery to give the woman, Isabelle Denoir, a more normal appearance. In a more recent development from 2016, a team of Thai physicians and engineers worked together to successfully transplant a working titanium thumb. After having her thumb amputated, the 37-year-old woman's working thumb was x-rayed so that it could be reproduced using 3D printers. The thumb bone, which was created with titanium, was stronger, lighter, and cheaper than many orthotics traditionally used in such applications. With so many other breakthroughs leading up to and going beyond present day, it's clear that across all healthcare sectors, there's a demand for creative, thoughtful uses of health informatics, mobile technology, cloud systems, and digital diagnostics. The future of healthcare will give physicians access to different delivery models, help them better focus on patients' behavior, and allow them to take a more team-oriented approach. This Doctor's Day, Barton is celebrating not only all that physicians have already accomplished, but also their bright future to come. Ready to go locum? Shoot us an email at info@bartonassociates.com, check out our website at www.bartonassociates.com, or give us a ring at 1-888-272-5084. And from all of us here at Barton Associates, happy Doctor's Day!